Toothache at 2 a.m., head pounding after a long day, knees stiff every time you stand up? Most people reach for another painkiller, but what if one compound dentists have used for decades could numb pain naturally, and it's sitting in your kitchen right now? Cloves contain a powerful active compound called eugenol. It doesn't just soothe, it actually blocks pain signals at the nerve level. And here's the part most people get wrong. Used incorrectly, clove oil can irritate your gums or burn your skin. In this video, I'll show you 1. How cloves reduce toothache in minutes. 2. How to prepare it safely for headaches and joint pain. 3. The correct dilution ratio. 4. And who absolutely should not use it. This isn't folklore, it's research-backed. Let's break it down. Why cloves work. Cloves come from the dried flower buds of Syzygium aromaticum. The key active compound is eugenol. Eugenol has strong analgesic properties, anti-inflammatory effects, local anesthetic action, and antibacterial activity. This is why dentists have used clove oil for decades in temporary dental fillings and pain relief. Studies published in the Journal of Dentistry show that eugenol can numb nerve endings and reduce pain transmission. It works similarly to mild local anesthetics. That's the science foundation. Cloves for toothache. This is where cloves shine the most. Eugenol acts directly on the exposed nerve, reducing pain and inflammation. How to use? Option 1. Whole clove. 1. Wash 1 to 2 cloves. 2. Place on the painful tooth. 3. Gently chew to release oil. 4. Keep in place 10 to 15 minutes. Option 2. Clove oil, stronger. 1. Dilute 1 drop clove oil in 1 teaspoon coconut oil. 2. Apply with cotton bud to the affected tooth. 3. Leave for 5 to 10 minutes. Relief often begins within minutes. Note, this is temporary relief. It does not treat infection permanently. Cloves for headache. Cloves may help tension headaches due to their anti-inflammatory and muscle-relaxing effects. A study in phytotherapy research highlighted cloves' anti-inflammatory properties comparable to mild NSAIDs in lab models. How to prepare clove tea. 1. Boil 1 cup of water. 2. Add 3 to 4 crushed cloves. 3. Simmer 5 to 7 minutes. 4. Strain. 5. Add small honey if needed. Drink warm. You can also inhale steam from clove-infused water for sinus-related headaches. Cloves for muscle pain. Clove oil increases blood circulation to the applied area. That improves oxygen delivery and reduces muscle tension. How to use topically. Mix 2 drops clove oil, add 1 tablespoon olive or coconut oil, and massage into sore muscles. Use 1 to 2 times daily. Never apply undiluted oil. It can burn the skin. Cloves for arthritis. Arthritis pain is driven by inflammation. Eugenol has shown COX-2 inhibition effects in laboratory studies, similar to how some anti-inflammatory drugs work. Animal studies published in the Journal of Immunotoxicology demonstrated reduced inflammatory markers after clove extract administration. How to use. Option 1. Clove tea daily. Option 2. Topical diluted oil massage on affected joint. Option 3. Add 1/4 teaspoon clove powder to warm water daily. Use consistently for at least 2 to 3 weeks to assess effect. Who absolutely should not use it? Avoid or consult a doctor if 1. Pregnant or breastfeeding. 2. On blood thinners like warfarin. 3. Have bleeding disorders. 4. Have liver disease. 5. Giving to children under 6, especially oil form. 6. Sensitive skin. Always patch test. Clove oil in excess may cause 1. Mouth irritation. 2. Skin burns. 3. Gastrointestinal upset. Dosage matters. In conclusion, cloves are not magic, but they are scientifically supported for temporary pain relief, especially toothache.
For chronic arthritis or severe pain, medical evaluation is necessary. If you want natural remedies explained with real science, not myths, subscribe now. Your health deserves evidence, not guesswork.